Welcome back. Now let's head off to the Eastern Cape now, which is battling several challenges as COVID-19 infections continue to rise. Hospitals are full and there's a shortage of staff. Health Minister Dr Zweli Mkhize is in the province today assessing how 2 hospitals in the Nelson Mandela Bay Metro are coping. Lerato Fekisi is our reporter covering this story for us. Lerato, the minister there, Dr Zweli Mkhize, was indeed setting off to perhaps give a few words, even give an update not so long ago. Any words with regards to what he was said at that briefing?
Good afternoon to you, Arabile. We actually just stepped out of a meeting where the Minister of Health is holding a meeting with various stakeholders from various hospitals and clinics in the metro. A few things coming out of that meeting. One, specifically this hospital that we're in right now, which is a quarantine hospital, for a long time has not had a CEO. The CEO has resigned, and the MEC of Health, Minister Gomba, has announced that an acting CEO, Dr Kamlashe, has been appointed, but she has also promised that within 3 months they're going to make a permanent person in that specific post. Another issue, Kalabile, was the issue of cleanliness at Doranginza Hospital and also Livingston Hospital. Really poor media coverage and bad images coming out a few weeks ago, showcasing the dirt, the filth in passages, in rooms inside these hospitals. But again, the Minister, the MEC of Health, Cindy Sogomba, has said that they've already now employed a permanent cleaning company who are going to go into the hospitals, these specific hospitals, and do a deep clean services from now going forward. Dr Mkhize then took the podium and he said that one thing that he's happy about is that all the issues Gomba has raised are issues that he also wanted to bring forward. He did also note and also pleaded with the MEC that can she also make sure that in terms of the death figures, can those be recorded very accurately every single day? You remember, Arabile, that about yesterday we had an interview with the MEC of Health, and she said that during her walkabout yesterday, she picked up that the death figures in the NMB were not recorded accurately, and there's current investigation underway to find out exactly who was at fault, and when they find that out, that person is going to be penalized. So the Minister of Health did say, and he pleaded that at such a time, such figures are so critical, and he asked that can these please be done accurately, consistently, the way they should be done. He also urged that people must make sure that they are still adhering to regulations, saying that if you test negative today, don't then go out and live as if you'll never get the virus again. Continue to sanitize your hands, continue to wear a mask. He also did urge that the MEC of Health quickly fill posts. He said for a long time, the Eastern Cape, there have been so many vacancies in terms of doctors, managers, project managers, but these vacancies have not been filled. He said that at such a time, we need all hands on desk. So it cannot be that at a time where we are peaking in the pandemic, there are still vacancies. So ask that the turnaround time in terms of filling vacancies be filled more quickly, much quicker than ought be done right now. So the meeting is still carrying on, saying that today is just really about hearing what the problems are. He's quite impressed with the strategies taken by the MEC of Health, and he's going to do a walkabout at the hospital to see exactly how far things are at this hospital. At this specific hospital, Arabile, as well, there is 11 million rand that's been set aside to renovate the basement of this hospital. It's going to be converted to a COVID ward, about 72 beds being available there. So I'm sure he's going to work around there and see just the standard of those beds and the standard of that ward, and see if they're up to scratch, and will be ready in time, especially as we head towards the most drastic time of this pandemic.
Yeah. Lerato, at the same time, we've got so much happening. I mean, 945 deaths in the Eastern Cape alone, just over 66,000 cases of confirmed coronavirus as well in the province. The minister must have urged to be a little bit more urgent and creating a little bit more excitement around getting things done as quickly as possible at this stage. Any word to where he sees estimates going with regards to the province itself when it comes to those COVID-19 cases? Are there any estimates in that regard?
He did say that the Eastern Cape and the Western Cape have been 2 provinces that he are watching closely, because they may not be at the top right now, but they're definitely in the top 5. I know the Eastern Cape currently is also ranked very high in terms of our figures. So he did say they are watching the Eastern Cape very closely. Also watching to see in terms of the turnaround time in filling posts, how quickly are we going to do that? Because the CEO at this hospital, the post, has been open for a very long time. And you can imagine at a time where leadership is so critical, management management is so critical. How could it be that a quarantine hospital for close to over 6 months there's been no CEO? So he said that in terms of permanent posts, those must be filled quickly, that the CEO must be employed within 3 months, like the MEC said. And he did say also in terms of workers, if a worker goes sick, we need to get more doctors and more nurses. The Eastern Cape had promised to employ more nurses and more doctors, and he asked that this must be done speedily. It mustn't just be a hearsay to say we will employ doctors, we will employ more nurses, but he wants to see these nurses on the ground working, helping to fight this pandemic, especially in hospitals that are filling up at such a rapid rate in this pandemic.
Any word then from community members, what they feel is kind of happening? Are they getting the necessary PPE? Are hospitals getting the right amount of PPE as well? They're finding facilities worthwhile going to as well? They're getting the help that they need?
I recently just a few minutes ago, I was reading just a tweet, and someone was saying that the issue at Doraginza Hospital is not an issue that started yesterday. For a long time, the infrastructure issues at Doraginza have been there. It was a very good hospital once upon a time, but due to corruption, mismanagement, it was run down, and community members are saying the Department of Health must step up. Beyond just speaking and promising, they must act. They must bring proper services to people, give health workers enough PPEs. They must go in and see the issues and deal with them concisively.
Yeah, Lerato Fekisi, appreciate the time. Thank you so much for that out in Port Elizabeth, then out in the Eastern Cape.